Thank you, Kristen. With January being National Birth Defects Prevention Month, we spoke with the chair of the OBGYN department at Kern Medical and Omni Family Health about when moms should start talking to their doctors about having a healthy pregnancy. The CDC states every 4.5 minutes in the U.S. a baby is delivered with a birth abnormality, meaning nearly 120,000 babies are impacted each year. Dr. Juan Lopez says moms should ask for ultrasounds to be performed in both the first and third trimester to locate abnormalities if present. Lopez also adds, while some birth defects are genetic and can't be prevented, others can be, like low weight or folic acid deficiency. He adds there are 2 birth defects that are the most common.
See these days that there are a lot of birth defects involving cardiac anomalies. That tends to be the most common birth defect. And then very close second are what we call neural tube defects, which is an example of that is spina bifida and abdominal wall defects.
The main way to prevent birth defects is by having a healthy pregnancy, which doctors call PACT. The 4-letter word stands for planning ahead, avoiding harmful substances, choosing a healthy lifestyle, and talking with your healthcare provider. So what happens if your child is born with a defect? We took a deeper look and found these resources and tips from the CDC to help your family stay happy and healthy. The first and most important thing to remember if your child is born with a birth defect is to acknowledge your emotions. You might feel shock, denial, grief, and even anger. Accept those feelings and talk about them with your spouse or partner and other family members. Also keep records. Use a notebook or your phone to keep track of your child's appointments, medicines, and treatments. And if needed, find different ways to pay for treatment and care for your child. There can be extra costs in caring for a child with a health condition. Other places to look include nonprofit disability organizations, private foundations, Medicaid, and state and local programs. And finally, get help early. Early intervention services and support are available to babies and children with special needs. Services can include feeding support, assistive technology such as tools, devices, and aids that make everyday tasks easier, and so much more.